Thanks very much to everyone who responded to our new way of communicating with our staff. We've had lots and lots of different questions and queries from our staff, and we're going to just try and theme some of those today and respond to those, and hopefully you'll find it useful and helpful.
Okay, lots of staff have queried with regards to their term time arrangements. So for those staff who have a permanent term time contract, you will not be affected. Your manager may discuss with you locally with regards reviewing or discussing some alternative options, but those staff who each year apply for term time on a yearly basis for each summer, those discussions will be held locally with your line manager on a case-by-case basis based on safe service need.
One of the other issues that has come up is in relation to staff pay. So again, just want to assure our staff and confirm that if you're off sick as a result of COVID-19 or if you are self-isolating as a result, you will receive your full pay. So the pay you would have received had you been in work.
There have been some queries with regards to sick lines. So for if example you have been self-isolating, you've been symptomatic perhaps with COVID and you still remain symptomatic and unwell after the 14-day period, you will need self-certification from your GP. It would be good to talk to occupational health with regards to those cases. So pick up the phone and dial the OC Health number. So if you're pregnant and you're under 28 weeks, you are safe to come to work, and your line manager will work with you on a one-to-one basis and carry out a risk assessment based on where you work and the nature of that work to keep you safe. If you are over 28 weeks pregnant and or have an underlying health condition, please talk to your line manager, who again will risk assess you. It's not an automatic that you are unable to work if you're more than 28 weeks pregnant, but we will discuss those cases with you on an individual basis and risk assess accordingly. Lots of staff have been questioning about their annual leave. So if you have annual leave booked, discuss it with your line manager. There has been no blanket ban on staff using their annual leave. Please discuss your request directly with your line manager. We have discussed with the Department of Health the potential for staff being able to carry over and accumulate their annual leave from this pandemic period over a 2-year period. If you have a family member who has an underlying health condition, this will not prevent you coming to work, so please discuss your concerns directly with your line manager. We will expect all staff on a case-by-case basis to be able to discuss their concerns directly with their line manager to support them at this time. And lots of our provisions include hotel accommodation, childcare and working alternate shift patterns. If you have to self-isolate yourself because of an underlying health condition and you've been notified by your GP to do so, please discuss that directly and immediately with your line manager, and you will receive full pay during this time. For those of you who are concerned about childcare, the Improving Working Lives team within HR are working very closely with our early years social work colleagues to secure childcare for those children aged 0 to 12 years. Please contact the Improving Working Lives team directly and we can make those arrangements to support you in coming to work. So within HR, we have developed a series of frequently asked questions. This is a regional document that's been informed by Public Health England, Public Health Agency and the Department of Health.